Welcome back to our channel Vibrance and Vitality. And today we are going to talk about a very much informational topic that is very important to our day-to-day life. Have you ever heard about the Pareto principle or 80-20 principle? Yes, friends, exactly. That is my topic today. Pareto analysis 80-20 principle. So, this principle is true almost everywhere in our day to day life, whether in the classroom, in the manpower output, in the delivery delays, customers' complaints, and patients' complaints in the hospital setup. So, today I am going to talk about the Pareto analysis 80-20 principle in the hospital setup regarding patients' complaint and other issues. So, Pareto was a scientist and he gave an analysis about the 80-20 principle that revolves around the concept of 80-20. So, what is 80-20? 80% of the problems caused by 20% of few major factors, and if we focus on 20% of the major factors, we can solve 80% of the problems. So, he says that 20% of few major factors, which are often referred as vital few. As I said, 80% of problem or failure is just caused by 20% of few major factors, which are often referred as vital few, whereas remaining 20% of the problem or failure is caused by 80% of many factors, which are also referred as trivial many. So, this principle is utilized everywhere in our day to day life as well. If we focus on 20% of our point and if we attack and address the issues of 20%, then the impact will be rest 80% of our life. So, if we talk about the in the hospital setup regarding the patient's complaint, so there are 5 causes of patient's complaint. Generally, suppose you are a common man and you visit to any hospital and you are waiting to ask about the OPD. Where is OPD? So you started to ask at the every point about the way to OPD, and there are long waiting times, long waiting queue are there. So 40% of the complaint is regarding the long waiting times. 25% complaint is regarding poor communication. Like the patient asks about the OPD, the way to OPD, and there is no sign, there is no display board regarding the indications of the direction, the left, right, or the clear cut demarcation that there is OPD. So 25% is regarding the poor communication. Then the 15% complaint is regarding the medication errors, that the right patients, right medications, sometimes there is poor communication regarding the medications, that regarding the dosage of the medications, the durations of the medications. So these all I am talking about the OPDs area. And the cleanliness, so uncleanliness, so 10% of complaints are regarding uncleanliness, maybe uh, regarding the surrounding area, on the way, or most of the time regarding the essential toiletries. And the other complaints are also some regarding the investigations reports, the x-rays report and others. So these 5 areas are very much concerned for the patient's complaints. So now how can we address these key issues by the 80-20 principles, and we can reduce the complaints. At the same time, we can reduce the readmission of the patients, we can reduce the duration of the patients in the hospital, and we can provide the better care, better service to our patients. So that is 20% efforts, and these areas are only 20%, and the results will be 80%. So 20% efforts, by 20% effort we can get 80% of results. And some other areas where if we can effort for the 80%, we can get only 20% effort. So why not we focus on the 20% efforts to get 80% results? Isn't it amazing? So Pareto principles and Pareto analysis says that you focus on the attacking area, the where you can only apply 20% efforts and you will get 80% results. So as we took the example of regarding the patient's complaint, causes of the patient's complaints, so we will address the same issues. So we will understand with the examples, like for the long waiting times, how can we address these issues? So we implement efficient scheduling system. How can we implement the efficient scheduling system? So there should be numbering system on the OPD, like number 1, number 2, number 3, 1, 2, 3, 4, 5, 6, 7, 8. So in this way we can deliver many outputs. Take now we will understand that if the patient is working somewhere and he comes in the hospital with some his laptop, and he has to report to his boss, and he is clearly know that his number is 8. So till 6 he can submit his report to boss, he can prepare any reports, he can talk to his boss, he can talk to anyone else in his family. So in this way his rest of the times are utilized in other work, and since 7 he will be aware that now it's my time to take the consultations to the doctor. So in this way he will be very much aware, and he can save his time, and he will be aware about to go to the consultation room as well. So in this way we can reduce the waiting times as well, and we can reduce the stress level of the patients, and we can reduce waiting times in this way also. At the computer system, the efficient technicians should be there, and he will be backup by the other computers, like there will be 2-3 systems in the backup, so that the times consumption will be less. So in this way we can reduce the waiting times of the patients. Then the next addressing issues was effective communication. Like, to communicate effectively, if we communicate to the patients for the histopath center to collect the report. So we should communicate him clearly, and there should be the display screen on the hospital area so that the patient will get the information that now we have to move left, now to right, now this is the way to histopath center to collect the report, for the lab investigation center. So he should be communicated like पहली मंजिल, दूसरी मंजिल, दाहिने साइड जाना, बाएं साइड जाना. So in this way he will get the information in the clear ways. Otherwise he can confuse. He asked to one person, then again he asked to another person. So in this way he doesn't save his time, and he is not doesn't get the clear information. So we should communicate the patients with the trained staffs, so that who knows the hospitals map or hospitals all the service center very clearly. Then the next is medication error. So sometimes there is error in the medication, and as we know there are 5 rights regarding the medication delivery system. Like we should scan the barcode, and then double checking method. We should implement the double checking method, so that we can scan barcode and again double check. So in this way we can reduce the medication error. If we take the example of the indoor patients, then we already know the 5 rights: the right patients, the right route, the right drug, the right time, the right power. So in this way we can administer the medication in the right way, and we can reduce the patient's complaint. Then the next is uncleanliness. So we should enhance cleaning protocol, and we should depute some dedicated persons to monitor the cleaning protocols. So in this way we can reduce the cleanliness problem as well, and we can address the same issue. So my dear friends, if we focus in these issues, so we can get 80% of result. It will reduce the infection rate, it will reduce the patients staying in the inside the hospital, in the hospitalization system. We can give other patients the date of the surgeries, and we can address the other patients in the same time, and we can reduce the readmission of the patients, because we can reduce the infection rate. So in this way our patients is very much satisfied in the mental level, in the physical level, and in the cleanliness level. So overall the patient will be satisfied, and we can improve the patient's care in a great way. So in conclusion, I would say that 80-20 principle is a very much valuable tool for the hospital setup to improve the quality, safety and efficiency in delivering the patient care services. By applying this principle, healthcare professionals can make data-driven decisions and drive meaningful changes, and can deliver the best care, the efficient care to the patients. So I hope this information will be helpful, as I explained with the real examples in the hospital setup, and you can get the clear-cut idea of the Pareto principle in action. 80% of consequences come from 20% of causes. So if we attack on the 20% of causes, we will get the 80% of consequences. Thank you for your patient listening, and yes, stay connected for more such informational content. Thank you all and have a great day. Thank you, friends.